Hello and welcome to my channel. I'm glad you found time to join me today. I am going to talk about the shortcut to a nurse's success journey. Once you have graduated from college, you will want to ensure that you are successful. But the journey for you to success can be long depending on where you start. Once you graduate, you get your certificate, and then you are supposed to have a license. This license is given by the Nursing Council of your country. Like if you are in Kenya, we have the Nursing Council of Kenya. They'll give you the license, which is an authority for you to operate. This license, you need to know that it is renewed yearly, and there is a fee that is given. Depending on the jurisdiction where you are at, you need to pay some money for you to be retained in the register of the nursing body that you are working with. So, and there is a requirement for you to renew this license. For example, you need to have 40 hours of continuous medical education. It's important that once you get the license, you keep updating yourself. The continuous medical education is important for you to keep abreast with the latest information on the care, on the practices of care for your patients. Now, having had your license, then it is important for you to consider specialization. There are so many areas that you can specialize in, and it is upon you to decide which one you need to specialize in. Here is where there is a challenge for many nurses. They do not know which one or which specialty they are going to take. But I'm going to give you a few points that can be pointers to help guide you in choosing the specialty. Most nurses will choose from an area where they enjoy working. Like for example, if you've been posted at a given ward, you might realize that you've been posted to pediatric ward and you enjoy working with children. Maybe you like a warm area because children usually get taken care of in places which are warm. It could be in newborn ICU, and in this place it is very warm. So if you don't mind working with babies, newborns, who are usually taken care of in warm environments, then it can be a good place for you. If you enjoy working with the children, then pediatric nursing can be a good choice for you. Now, that is where you are placed and where you like working. You could even be placed in a maternity ward and you find that you are enjoying midwifery. You enjoy working with mothers, helping them get their new ones. So if this is your area, then you might even choose midwifery. The other factor that will help you choose is, one, you might find that your colleagues, your friends that you trained with in college, they have decided to go and do something, and they may tell you that, okay, this place is better, we've done this, this specialty is better than the other one. So some people get informed by their colleagues and they decide to join them, maybe their friends or their colleagues. The other third factor that you might consider in your specialization is sometimes it's accidental. You may not have even planned about it, like you are just upon graduation you are placed in a place, maybe like in a dialysis center, and you can be working there and you realize, oh, I like working with patients. So you can even decide with patients who are having neurological problems, who will require dialysis. And if you are such a person, then you might consider nephrology nursing. The other factor for some people that, some nurses that they would like to look at is remuneration. Some specialties, pay you better than others. So you might look at it and ask, okay, how will I progress in my career? Career progression is also another factor. You can specialize in an area which does not have a trajectory for you to progress. So find out, how am I going to progress from this career that I've chosen? Like if you could have done a higher diploma in maybe it's peri-op, you need to find out, are you going to have a master's in that peri-op? Can you do a PhD in the peri-op, or are you going to get stuck in one area that you have just specialized in? Other than remuneration, some people will like to be traveling. Like, so you might choose to be a travel nurse. So it depends on one's personality, one is hobbies. If you don't like to stay in enclosed areas, then you might want to specialize in travel nursing, where you are going to take care of patients, in which case you might consider specializing in trauma and emergency nursing. Because this one you may work in the ambulance with patients that have had trauma, and you may need to travel from one area to another. So if you are a person who is out there, an extrovert, you want to travel from one area to another, you don't like to be restricted in one area, then you might even consider travel nursing. The other thing that makes people want to specialize in one area or another, sometimes it could be even a surgeon who will tell you, or a doctor that you are working with. They might even discover, or you might even find that it's a nurse manager that once you are working with them, they look at you and say, this person is, or this nurse is working well, is fast enough, is taking attention to detail, and they might even request or suggest for you to do perioperative nursing, in which case you are going to take care of patients before they come to theater, during the procedure, and after they have been operated on. So depending on your temperament as well, if you are fast enough, if you are able to work in environments which are high pressure or high stress environments, then these are some of the things that can inform your choice of career. And once you have decided what you're going to specialize in, it is good for you not to waste time. You know, some people have this what we call analysis paralysis, where you sit, you think, oh, do I start this, or maybe I'll start next year. I'm not going to start now, maybe I'm having a problem with the funds. Once you choose that this is what you want to do, apply. There are so many institutions that are training specialized nurses. So you need to apply as early as possible, start getting funds, and once you start, you realize that it takes a very short time. Most of these specialty nursing, they usually take 1 year. So if you have already decided that this is what you need to do, then just go for it. Apply, get the funds ready, and join your colleagues. So specialization has so many benefits. One, you are having a razor sharp focus about the skill that you want to get. You understand your equipment better, you understand the conditions better, you understand the complications, you understand the processes very well, and you are so proud of your skills because you are very skilled in the field that you have decided to have. So these are some of the factors that nurses look into when they are choosing to specialize. So if you are there, maybe you have not considered what specialization you are going, specialty, nursing specialty you are going to take. These are some of the things that can help you. Or you can even be having some nurses who are role models, who work very well and they enjoy what they are doing. And then you may look at them and say, oh, I want to be like Mr. Nurse so and so. So if that is what you want, if you have enjoyed the way they are or they have taught you, then choose one area and go for it. So these are, see you in the next video where I'm going to talk about the various areas of specialty.